About 42,000 Americans are reported to have recovered from the coronavirus. That's according to Johns Hopkins. We wanted to see what it's like for patients who have gotten better, including the possible effects on their mental health. Our Dr. Tara Narula spoke with a doctor who recovered after he spent days on a ventilator.
This uplifting video taken last week at New York's Staten Island University Hospital shows veteran physician Michael Sharippa's release from his own hospital after a more than 2-week battle against the coronavirus.
I was intubated for 3 days. I remained in the ICU for probably an additional 6 days.
Dr. Sharippa had been treating patients only days before contracting the virus, but is now at home resting, feeling fatigued and on oxygen support.
Did they talk to you about any possible long-term damage to any of the other organ systems?
I was really grateful because heart disease runs in my family. I have hypertension. I'm saying I hope my arteries are good because this is really a stress test, and I realize that all the organs are tied in.
COVID-19 is a virus that involves the respiratory tract that can damage the lungs and require mechanical ventilation. But experts believe the impact of the virus isn't limited to just the lungs.
This is a condition that attacks the entire body, that can attack the heart and the kidneys and the liver. It can attack the coagulation system, the endocrine system, the neurologic system.
Dr. Harlan Krumholtz is a professor of medicine at Yale University.
So just because somebody has survived the acute episode, they've been extubated, they've gone home from the ICU, doesn't mean that they're out of the woods.
Cognitively, physically, their mental health can be affected. There's all sorts of things that happen afterwards. So we need to provide support. It's not like, hey, you've been through this and you're done, but they need to be understood as continuing to be vulnerable for some time. So, we don't want to freak people out. We don't want to scare people. We don't want to contribute to the greater anxiety, but we want people to be informed that this is a big deal.
Gail, it's important to remember as we monitor patients going forward for concerns with other organ systems, we can't forget about the psychological system. We know that in patients who survived critical care illnesses or been in the ICU, they are at risk for development of PTSD or depression. So important for families, providers, friends to really be aware of that, as well as the patients themselves.
As a doctor, Tara, I can't imagine what it's like for doctors to see one of their own recover, because you all know exactly how hard that might have been for that particular person. That was great video.
Thank you.
Thank you, Dr. Tara Narula.